Welcome. In this demonstration, I want to show you how we could do an adjustment to make the center of force icon move closer to the middle. This is assuming that the patient has all their teeth, or at least 2 through 15, available for adjustment. This can change if they're missing teeth 2 through 5, and in that case the actual target zone, which is this white ellipse here, would be shifted to the left and up a little bit. But in this case we want to see how we can get this red trajectory pattern closer to the center. And so if we look at the arch right now, we're at maximum intercuspation, and we see that the pattern starts somewhere in the middle to the right and pulls back to the posterior teeth. And a good tool to understand where to start your adjustments would be the graph and the timing table. In the timing table there's this tooth selection icon, and this allows you to identify the teeth that are of interest to you. And so based on this information, I would likely want to know how the relationship between 2, 3, and 15 are, since they are the 3 teeth with the highest total force. So I can go to 2, click on 2 on the arch here, 3 and 15, and the graph will show me those 3 teeth in relationship to each other, and we can see that the dark blue, which represents tooth number 2, is the highest total force, and it's actually probably about 50% more force than both 3 and 15, give or take some percentages. You can also identify that through the percentages on 2, 3, and 15. You can get that perspective, but sometimes the visual is good for the patient, trying to explain what your concerns are, where you're going to start your adjustments. Another cool piece of information that you get from using the tooth selection is when these contacts are loading. And so you can see during closure, which is represented between A and B, the dark blue is more forceful, but it actually rises from 0 on the graph sooner than either the 3 or 15 tooth. And so this is a good indication that, okay, so this is probably where we want to start our adjustments, is on 2. So now I'm going to show you the next scan. And within this next scan, you can see that after the adjustments on 2, 3, and 15, removing some of those high contact forces, the center of force trajectory here has shifted towards the center. And so this is a quick identification using the tooth selection to see the relationship, knowing that our first adjustments based on the graph was number 2, followed by 3 and the brownish color here, and those were the contacts with the highest forces, and we were able to be very specific just to the high forces. Hopefully this example showed you how to use the Tekscan tooth selection and the graph to help make better decisions, identify primary contacts to adjust first, second, and third, and is helpful for future adjustments with your patients. If you have any additional questions, you can contact Tekscan, or you can go to our online website and look for additional resources, and our videos are available. Thank you and have a good day.